not see. Today, 6 key Senate Finance Committee members of both parties are meeting. The chairman of that committee, Max Baucus, is going to be talking about this compromise he may be putting on the table. It's reported fees for some sectors of the insurance industry. All this comes as the president will be meeting with Nancy Pelosi and Harry Reid in advance of tomorrow's address to a joint session of Congress. A lot to take in. Let's get to Heather Higgins. She is the chair of the Independent Women's Voice, and Jamu Green is former advisor to Hillary Clinton. Good morning to you both. Jamu, first to you. You know, most would say the president, what he needs to do tomorrow is reframe this debate. First of all, is it too late? Second of all, if not, how does he do it?
It's absolutely not too late. We've just come through August where we had so many Americans having conversations with their members of Congress, showing the deep-seated passions that are existing in this issue. And I think President Obama has a unique opportunity in his speech tomorrow to, one, share how far we have come, how this is unprecedented progress we've made. 4 out of the 5 committees have bills that they're looking at, and that is the furthest we've come out of 5 presidential administrations. I think also he has to reframe the debate, as you said, to make sure that Americans know what is at stake and what's not at stake, because so much fear and so much misinformation has been put out there, and to really re-engage the American people in the urgency of this, that inaction is not an option, because I think what we have seen from, unfortunately, the Republicans is that they just want to stop Obama at all costs. It's an electoral issue for them, but it's not an electoral issue for people who are afraid of losing their homes because of health insurance issues, people who are afraid to start a small business because they aren't going to be able to get insurance because of a pre-existing condition. It's not an electoral issue, and I think President Obama is really going to be able to impart that sense of urgency in his speech tomorrow.
Heather, I know there's a lot for you to rebut there, but just on the very end of Jamu's point there, I think what most people would say, or many people would say, looking at these town hall meetings, is that it isn't just about health care, that it's about a lot more, that so much spending and so much seems to be changing.
It is. People elected Obama hoping for hope and change and thinking that they were going to get something different than Washington as usual. And instead, what we've seen is Washington on steroids. It seems to be that there are no adults in the place who recognize that there ought to be fiscal responsibility and that you cannot spend your way to saving money. There's panic, I think, legitimately so, that we are getting ourselves into a situation that could lead to serious inflation and other problems, but there's also real concern about health care. And the compromises that are being offered are being sunk by the same thing that led to the problems that he had in August, which is the internet. People can actually read. Just as Van Jones was done in by people going back and just a simple Google search showed what he actually said. People can see what Rahm Emanuel's brother Ezekiel Emanuel says. They can see that there are many people out there who've been talking about how the public option is just a Trojan horse to get to single payer, how co-ops are really just another form of public option, how all the mandates, all these different proposals, the trigger is just another way to get there more slowly without admitting
play
it.
a soundbite from former Speaker Newt Gingrich about his idea going forward and get your response real quickly on the other side.
I would hope that the president would back off, suggest that maybe we should pass 5 or 6 bills, each of them 200 or 150 pages, manageable, understandable, do it out in the open, do it in a bipartisan way. But if he comes back tomorrow night and tries to ram through a massive bill, I suspect in the end it'll fail, just as it failed in 1994.
That's Mr. Gingrich from Fox and Friends this morning. I really only have 15 seconds for each of you. Jamu, what about that idea? Smaller parcels we could all understand.
Well, Heather is right. President Obama was elected on a very strong platform of hope and change, significant change, and that's what he needs to say to Congress tomorrow. This is about significant change. This isn't about incremental changes that aren't really going to affect the American people when it comes to the crisis, a true crisis we're facing with health care. And it is about playing politics as usual as far as what the Republicans have been doing with Van Jones and with health care and with the town hall meetings. It's time for us to move past that and get some real change, some real reform on this issue.
Heather, quickly from you.
The speech that he's giving on education this afternoon could have been written and delivered by Jack Kemp. And he should take his own cue from that. He should be genuinely bipartisan. He should slow down, as Newt said,